Hello, I'm Dr. Dennis McKenna, joined today by Mr. John DePaula. John, great to see you.
Good to be here, Dennis.
Giving you the update from Albany Med. Today is Thursday, February 3rd. Now, John, yesterday was Groundhog Day.
Yes, it was.
What is the status on the groundhog?
Phil saw his shadow. So 6 more weeks of winter.
Okay.
But on the bright side, we're an academic medical center,
right?
We're all about research and data.
Right.
And the data actually indicates over the last 10 years,
Yes.
Phil has only been right 40% of the time.
Coin flip.
So, yeah, there's a good chance
Less than
that
a
Phil
coin flip.
may be off one more year, and
Yeah.
maybe it won't be 6 more weeks of winter.
Well, he's right today, though,
Yeah,
because we are getting snow today. All right, very good. Thank you for that. Let's pop open the first graph here. Let's take a look at cases in New York State diagnosed with COVID. The current number in the state is 6,628. You can see that graph. You can see the numbers are coming down very steeply. Next graph here is the capital region. You can see that number is 325. When you go back to the most recent wave we've been on, John, that number was as high as 420. So again, 325 coming down. Interestingly, also the number of new cases per day being admitted to hospitals in the capital region is also coming down. That number is about 39 or 40 a day. Just a couple weeks ago, we were looking at about 80 or 90 per day. So the total number is coming down, and there's even less coming in over the last week or so. Next graph here, inside Albany Medical Center, admissions and discharges. We're really back down to single digits per day. We had a couple weeks where we were doing 10 to 20 a day. I think lately we've been running in the area of somewhere between, say, 4 and 8 or 10 per day. And then last graph here, here's the morning census here at Albany Medical Center. This number now well under 100, so we're currently at 76, and that breakdown is 70 adult, and we have 6 pediatric. Just a couple other data points, John, just to talk about the capital region rolling 7-day average of people who are testing positive. That number now is under 10%. We'd gone up as close to 20, so that's also moving in what I would say is the positive direction, coming down, which is good news. Let me pop open one more graph here. This is the variant types that we see on the horizontal axis. It's time going left to right. The bar now is 100% in this area, Omicron, which is what we kind of predicted a couple weeks ago. When that strain comes through, it obviously becomes the dominant strain. The good news is although it is more transmissible, it is significantly less severe, much less severe, much less likely to land you in the hospital. All right, so that's the update on COVID. John, let's shift gears a little bit. Let's pop open our first graph here. This is length of stay. And you and I were talking today about as the numbers come down with COVID, we're obviously always going to focus on that, as we do all other seasonal viruses and infectious diseases. But we do have to focus on other things. So talk about safety brief, talk about length of stay, talk about recruitment and retention, tie those all into length of stay.
Will do, Dennis. So I'll start off with actually COVID. Our workforce has experienced very similar trends that you alluded to that's going on in the state and the region. So we actually maxed out at 660 of our staff that had tested positive for COVID on the January 10th date that weren't able to come to work. Just this morning, the number is down around 100. So we come down significantly. So that allows us to have more staff here at the medical center to really serve our mission of taking care of more patients. And what we do in the daily safety brief is we've transitioned now to a virtual safety brief where we now have a visual of a lot of different data elements and key performance indicators that all of our leaders are monitoring, those who are in the room and those who are actually participating, who are not at the medical center. So we had one of our leaders down in Florida actually sort of paying attention to what the dynamics are. And again, length of stay is something that we pay very much attention to, and it's actually trending in the right direction this week, looking at the report from this morning.
So that graph we showed, it was going up. That's lagging by a couple weeks. You would suggest a new graph, if we refresh it, will show us going back down towards lower numbers.
100% yes,
okay,
Dennis.
Very good. And the dashboard you talk about at the safety brief, this is a virtual command center view of all the important metrics, operational, quality, safety, staffing. Do you want to give any credit to anybody who helped pull that off?
Yeah, definitely. We've joked about this. I was incredibly worried that, we transitioned from a safety brief that really you created about 5 years ago that really was very efficient, very effective in calling out all the people to report. We've gone to this sort of virtual huddle board now, visual, where people have to actually, prior to the start of the safety brief, have to actually enter information in on Microsoft Excel, sort of call out in red when they want to be called upon to report on an issue.
Right.
And really, I mean, again, credit to Don Weisenforth,
Good.
Michael Hamilton, Scott Heller, Mohammed Al-Mashre. They've done an amazing job. It's gone incredibly smooth this week. And really, I've been watching the clock, and typically we take about 10 minutes
Right.
prior to going virtual. And really, the last 2 days, we've been right at that 10-minute
Right.
mark. So it's really, really been positive.
I agree. It's wonderful. Thank you so much for making it happen. John, let's talk about the booster mandate. We know the date set by the state is February 21st. So for those individuals who are still looking to get the booster, we're offering clinics. We have a Moderna clinic happening on campus today. There'll be many others that will certainly get scheduled over the next couple weeks. You may get it in the community. Just make sure if you do not get it here on this campus, you upload your information into a program called QUIK. That's QYK, and the instructions are on the intranet.
That's right, and we talked about this in Incident Command this morning. Mike Hauk has, again, done an amazing job. We're going to be able to push the data out to all of our managers of staff in their departments who have not yet received the booster. We're going to track this on a daily basis, our progress with how we're doing with people getting boosted up until that February 21st date, and calling it out on a daily basis of where we stand. And Dr. Pausé mentioned this morning that he felt where we are currently, we've got about, we estimate 50 to 60% of our staff who've received the booster vaccination, that we are kind of right on pace with where we were previously when the state required us to have everybody vaccinated for COVID. All
right, we'll keep tracking that. Let's talk town halls. Last night I was able to participate in a town hall on WTEN. It was shown on local Fox network. It was with other leaders in the community who have been dealing with COVID, physician leaders from within the Albany Med Health System, as well as other hospitals within the region. It was great. It was a great opportunity to talk about how we had worked together over the last 2 years with the pandemic. If you want to watch that, it's on news10.com, and also the link will be on our local social media. So I encourage you to check that out. Speaking of town halls, we've also done our own town halls here on campus. I've done 6 of them so far. I have one more this Sunday morning in ME 700 at 7:30. If you are on campus and want to come by, I encourage you to do so. Chance to look back, everything that we accomplished in 2021, look forward, what our goals are, what our aspirations, what we want to accomplish in 2022. And for those who were unable to attend any of those, we'll make a video of one of those town halls available and the slide deck, and we'll put that online once we finish the one on Sunday.
Great
Very
stuff,
good.
Dennis.
John, let's talk about one of our significant strategic priorities in 2022. We have 2 primary ones: workforce and our new electronic medical record and our new ERP. There's a nice article out there on the intranet and on our website about the rollout of our new EMR and ERP, about our system, the Albany Med Health System, Columbia Memorial, Albany Med, Saratoga Hospital, and Glens Falls, working together with this new platform, these 2 new platforms, to improve care throughout the region. And I know I'm very excited about this.
Yeah, I definitely am too, Dennis, particularly the electronic health record. I mean, we really got an excellent product out there. Epic is outstanding. And I really see it as an investment in our workforce to be able to use this type of tool to make their work experience better, more positive, and more thorough in taking care of our patients. So I'm really looking forward to it.
Yeah, it's going to transform care for sure. A couple of other things happening here on this campus. The 2022 Community Grand Rounds continue. The next one's going to be called Screening Health Conditions in the Black Community, and there'll be a link and you can watch that via WebEx. So please look for that. That's a very important topic. I'm really proud that Albany Med has these important community grand rounds and some really important discussions.
Yeah, me as well, Dennis. We do so many of these activities within the community. Again, it just helps fulfill our mission,
right.
In partnering with the community on so many venues.
We like to use these videos to call out, when it comes to our attention, various different days or weeks or months that we're celebrating. Today, I'm very proud to announce that it's National Women Physicians Day. And we're so lucky on this campus. We have incredible women physicians in both front lines as well as in multiple leadership roles throughout the organization. So we congratulate all of you, and I want to thank Dr. Gina Geis, who's one of our physician leaders, for bringing this to my attention. So
congratulations to our women physician faculty.
Let's end on two items, John. First of all, you did some walking around today with physical therapists as part of senior leader rounding. Can you spend a moment talking about that?
Sure thing, Dennis. I did. I actually attended the physical therapy, occupational therapy huddle board yesterday. Had a session, and really it was pretty much 30, 40, 50 of their staff that was there, all of their staff. And they were calling out some issues that I thought were important, some opportunities to make things better. And I offered to shadow one of the physical therapists and occupational therapists. And one of the physical therapists immediately volunteered, Rachel. And I spent an hour with her just before coming here this morning. Really, I can't tell you how touched I was by the care that she delivers, the passion that she has in caring for our patients, doing so many things that really, sort of, quote, aren't in her job description, that she went above and beyond to care for patients. And we ran into one patient in particular who was a transfer from one of our community hospitals, who both him and his spouse, his wife, basically said he wouldn't have made it if it weren't for Albany Medical Center. And they were incredibly grateful, and his wife commented on something that we talk about a lot, the incredible teamwork that we have here at Albany Med. And I'm just so proud to hear it from one of our patients and family members of the incredible teamwork that all of you do provide here for our patients and for our overall success. So thank you to Rachel, and thank you to all of you.
Yeah, we have some incredible therapists here: physical therapy, occupational therapy, speech therapy. They all do a wonderful job. They're a huge, important part of our team. Lastly, we have a Daisy Award winner, our monthly Daisy Award winner. To remind our viewers, these are nurses on the front line who have been nominated by and recognized by people that they've cared for through write-up stories, and it's always a special event. Fred and I always joke about the cinnamon buns that one gets for winning that. But John, this month's recognition goes to someone who works in the pediatric ICU. Very special.
Yeah, her name is Sophie Brennan. And Sophie was nominated by the parent of a 19-month-old boy who spent 2 nights in her unit. The nominator wrote, quote, "Sophie built a trust and relationship with our son immediately. She was reassuring and friendly. Thank you for caring for our son."
Yeah, doesn't get any better than that.
It certainly doesn't.
Wonderful. So congratulations to Sophie, and obviously we're so proud of our pediatric ICU. It's the only one in the entire region that cares for the sickest children, and that's very special. And we always appreciate that the families take the time to recognize our nurses as well.
Certainly.
All right, very good. All right, John, that wraps it up. Thank you very much for being here.
My pleasure always.
All right, let's get back to work. For all of those who are working here this weekend, we appreciate you being here 24/7. We hope you all stay warm with the snow. Be careful out there. Take care of yourselves. Take care of each other, and we'll see you next week.